We have breaking news to tell you about Russian and Syrian warplanes bomb a Canadian-run clinic in Aleppo. The Al-Maraj Primary Healthcare Center was completely destroyed. The facility is supported and operated by UOSSM Canada, a Canadian non-profit. And Dr. Anas Al-Kassem is the head of UOSSM Canada, and he joins us now on the phone from Oakville, Ontario. So, Dr. Al-Kassem, what can you tell us about this bombing?
It is very unfortunate, the sixth bombing of medical facilities within 1 week by airstrikes. We heard about the very unfortunate bombing of the healthcare facility, which is supported by MSF and our organization, the Union of Medical Care and Relief Organizations, just a couple of days ago, and more than 50 people killed, including patients and physicians, nurses. And today, our primary health care center, the main one in Marja, in the middle of the city of Aleppo, was hit directly by another airstrike. There was big damage in the building. The equipment, the supplies are damaged, and it's out of service. But thanks God, we did not have any people killed in this attack.
Okay, so that was an important piece of information that we were trying to find out. So was there just nobody in the facility at the time that it was bombed?
That's right. There was no one at that time, and we're so lucky. The physicians actually came in just 15 minutes later on when we found big damage in the place and almost completely destroyed.
So what can you tell us about this facility, where it is exactly? You mentioned that it's in the center of Aleppo, and what kind of facility it is.
It is a primary health care facility. So basically we take care of basic health care issues, including blood pressure, diabetes, COPD, asthma, and things like that. The city of Aleppo, it still has about 500,000 population on the east side, which has been bombed almost on a daily basis in the last few years. So we provide care to children. We have a dental clinic attached to it, to adults for chronic health care issues. There's no surgeries there, no wounded, no injured. It's just about, basic health care issues that we take care of. We provide them with free x-rays, free blood work, and medications. And many of these medications being sent from Canada, from UOSSM Canada. We get lots of donations here from hospitals and NGOs, and we ship a container every 3 months or so. Unfortunately, this is one out of 11 primary health care centers that we operate inside the country, and it's out of service now.
Were there Canadian physicians or Canadian staff working at this facility?
There are no Canadian physicians. We used to go in, but recently became quite dangerous since the healthcare facilities and the physicians, nurses have been targeted directly. We heard last month a very pioneer physician in Hama district was directly targeted, driving his car to the border to attend one of our training courses. So it became very dangerous for the Canadian physicians and nurses. We advise them not to cross the border until we hear otherwise from the Turkish and the Canadian authorities that things are improving, but there are no signs. Things have been really getting worse in the last month, particularly in the last week, where 6 facilities were directly hit by airstrikes. We don't know exactly why this is happening, whether it's Russian or regime airstrikes, but it's really very sad.
Because in your news release, you say it's the Syrian regime and Russian airstrikes bombed this healthcare center. So how do you know that it was the Syrian regime and Russian airstrikes?
One of the two. We know that ISIS, they don't have airstrikes, and ISIS are just, fighting on the ground. And we know that the opposition, they don't have airstrikes. And the coalition, I don't think they are targeting the hospitals. As far as we know from the people at office inside Aleppo, these are either Russian or regime airstrikes. We cannot really sometimes differentiate between the two. Usually the airstrikes by Russian are more accurate and they target the facilities directly as opposed to the barrels which are thrown, and they're not as accurate. But it's sometimes not easy really to differentiate between the two.
Why would your facility be attacked?
Very good question. We've asked UN this question. I went to Geneva in December last year, and we had a big conference with UN and WHO, and I presented the data presented what we have left in terms of physicians and nurses as striking numbers, and many of them left the country in the last few months since September, where the Russian airstrikes joined the regime airstrikes. And we did not have an answer. Even I asked the UN the question you're asking today, and they said they don't know why. But, you know, the assumption is that I get it from them, that they want the healthcare providers, the medical care relief organizations, the humanitarian organizations to leave the country. That's what I get out of it.
What do you make of this, that this is happening more and more? As you say, you know, the last pediatrician in Aleppo killed just the other day, and now your facility has been struck and destroyed.
It is beyond imagination. What makes me really feel sad is not Russia or the regime, because they've been doing this now since September, attacking the healthcare facilities, but the world has been silent. This is very striking. The international community, UN, nobody's saying anything. US, Europe, everyone's just like looking and saying, well, this should not happen, and we're going to talk to our Russian allies. We are healthcare providers. We're doing this for 4 years or 5 years since this war started. We have treated all sides of the conflict, regardless of their backgrounds, religion, or ethnicities, but still they are attacking the healthcare providers and the healthcare facilities, and the world is just looking at this. It's very, very shameful.
Well, Doctor, as you say, fortunately nobody was in the facility at the time, so nobody was hurt or killed. But you know, a difficult day for you. We appreciate you explaining this to us. Thank you.
Absolutely. Thank you very much for having me.
That was Dr. Anas Al-Kassem, the head of UOSSM Canada, joining us from Oakville, Ontario. We'll bring you all the latest developments on this breaking story here on CBC News Network.